Have you ever wondered if something as simple as the size of your blood pressure cuff could really affect the numbers you see on your monitor? It turns out that this seemingly small detail can have a surprisingly big impact on your health insights. A blood pressure cuff that is the wrong size directly impacts your readings, leading to results that are not accurate. If your cuff is too small, it can give you a reading that is artificially high. Conversely, if the cuff is too large, it might provide an artificially low reading. The reason for this lies in how the blood pressure monitor works. The cuff's purpose is to temporarily stop blood flow through your brachial artery, located in your upper arm, and then gradually releases the pressure while the monitor detects your systolic and diastolic pressures. A cuff that is too small has to inflate to a much higher pressure to compress the artery adequately, which translates to a higher number on the screen, even if your actual blood pressure is normal. On the other hand, a cuff that is too large cannot apply uniform pressure across the artery, allowing blood to flow more easily than it should, resulting in a deceptively low reading. The internal bladder, not just the fabric, must properly encircle your arm to get an accurate squeeze. To ensure you get the most accurate readings, it is essential to use a cuff that fits your arm correctly. Before purchasing or using a monitor, measure the circumference of your upper arm, midway between your shoulder and elbow. Then, compare this measurement to the sizing chart provided with your blood pressure monitor. Most monitors come with a standard size, but many brands offer small, medium, and large cuffs. A properly fitting cuff should be snug enough that you can barely slip two fingers underneath it, but not so tight that it pinches your skin. An important tip that many people do not realize is that the critical part of the cuff is actually its inflatable bladder, not the fabric wrapping. This bladder needs to cover at least 80% of your arm's circumference to ensure even pressure distribution. Using the correct cuff size is just as vital as using the proper technique for taking your blood pressure and ensuring your monitor is calibrated. Inaccurate readings can lead to misdiagnosis, unnecessary medication, or, worse, undertreatment of real hypertension. Ultimately, using the right blood pressure cuff size empowers you to gather reliable information about your heart health. Accurate readings mean that you and your doctor can make the most informed decisions about managing your blood pressure, leading to effective treatment and ultimately, better health outcomes and greater peace of mind.